When a person says there is no evidence, about 99% of all I've ever seen on social media who say, oh, there is no evidence, actually have never read any evidence, nor have the experience of any evidence. They are just quoting somebody else who said it. And that person in themselves, how trustworthy are they that they have read all the evidence? I've never had a patient come in to see me who didn't have a problem. The evidence is when a person comes in, for example, with knee pain when they squat, and we review the video and we see that they have the knee valgus position occurring at the point where they indicate they have pain. Now, if I strengthen the external rotation, abduction and extension of the femoral muscles, basically the gluteals, we find more often than not that we have resolved the situation of pain. So in that person, we have just demonstrated evidence that the knee valgus is in fact the cause of their problem, and it is due to weakness of the muscles holding the femur as they squat to maintain a better and, shall we say, more optimal force transfer. Clinical evidence realistically far outweighs what somebody sits down and reads, because 99.9% of the time a person who reads a research paper does not understand how it was constructed and how it was put together, the interventions. They'll just quote the conclusion. Maybe they might read the abstract. Evidence comes from many different forms, but the most powerful evidence is that which you personally experience. And when you personally experience something, you can then read the research and understand where perhaps it applies and where perhaps it may have failings. Reading a mathematical meta-analysis and telling us that you know what the evidence is really is so far removed from reality. Clinical reality is evidence is your personal dealings with physical patients in pain.